Hi, Alex. This is Dr. B, and I am going to be watching your presentation for the very first time. And as I do it, I'll be making some comments. So, what I'm seeing here is a professional looking slide presentation. I do notice that it was a little bit short of 5 minutes, so you might see a minor deduction there. No big deal. And let's go ahead and get started. Looking forward to this.
Remdesivir, according to Wikipedia, is a broad-spectrum antiviral medication. That
Okay, looking good.
just means that it is a medicine designed to fight viruses and that can be used against a wide variety of them. It comes in liquid form and is administered by injection.
I always think that merits some comment. Nobody in the drug development world wants to really do this unless you have to. The usual quote is that you lose 90% of the market when you do that. People are afraid of the needles, things like that. So that does make me wonder if you could dig a little bit deeper into going into that. Of course, this looks like you're just talking about the history. So off we go.
Its chemical formula is C27H35N6O8.
Yeah, that's not particularly informative. You want to see the actual chemical structure. That's like saying Alex Ferguson is, 94% carbon and 6% hydrogen, blah, blah, blah. It's not a good way to look at a molecule.
It is also known as GS5734. And here is its
there it is. So there's the adenosine part. There is the cyclic sugar type part. There's the tweak that makes it not like adenosine. Here's the phosphate that gets added as a prodrug, which gets cleaved in the bloodstream. Now you're talking.
Molecular structure. Research on remdesivir began in 2009 when Gilead Sciences was searching for a molecule capable of fighting respiratory syncytial virus and hepatitis
It's
C.
interesting, just a personal note here, that they were a really small company at that point, and they hired a lot of Neurogen people. A few friends of mine ended up working for them. One of them, Kevin Curry, who I worked side by side with for a couple of years, is now their entire head of their medicinal chemistry department, which is, geez, it's such a worldwide phenomenon right now. So anyhow,
of the 1,000 or so molecules created, remdesivir was one of the few that worked. Remdesivir is a prodrug, meaning it
now
metabolizes
you say it worked,
into
but it never became a drug, so Gilead might think of it more as a failure. But if you're in this field, that's what you do, is you work with your failures always, and you just never give up.
a different form once it enters a cell. As you can see here, the structure changes into this nucleoside triphosphate. This inhibits RDRP, a part of the RNA that viruses use to duplicate.
Sign of deep research going on. I had never heard of this triphosphate intracellular substance. How do you like that?
Cells. This makes remdesivir active against a wide variety of RNA viruses, including yellow fever, type 2 dengue virus, influenza A, and parainfluenza 3.
Hence the term broad spectrum. RNA viruses. Isn't HIV an RNA virus, right? I wonder if the list is even longer than this.
In 2014, there was an Ebola outbreak in Africa. Gilead, working with the CDC and the United States Army Medical Research Institute of Infectious Diseases, determined that remdesivir may be an effective treatment for Ebola.
I find this, I just have to say that I find this very inspiring, that here is the U.S. getting involved in something that's taking place in Africa, right? Not exactly an America first sort of policy, but I think it's heartening, right? Because it's such a terrible outbreak.
In 2015, they began testing on healthy volunteers and later on Ebola patients. A study conducted by the National Institute of Allergy and Infectious Diseases tested 700 patients. Some were given remdesivir, some were given drugs from the company Regeneron, and others received a drug from MAP Biopharmaceutical. As it turns out, the Regeneron drugs were the best, with only 6% of the patients who received them dying. The MAP biopharmaceutical drug did all right as well, with 11% death rate, while Gilead's remdesivir was the worst with a 33% death rate.
Okay, now you got to compare this to a control. What about people that received nothing at all?
So although remdesivir was capable of inhibiting Ebola, It was not nearly as effective as other medicines, and for that reason, research on it
Now
for this
hold on.
purpose was finished.
That's interesting. Where's the control study here? How many is it assumed that everybody dies unless they get something? Um, right. Yeah. I mean, good point. 33% death rate's not great. The 1% death rate's not great, but Ebola is just nasty. I'd want to see the safety profile on each of these. If this thing is far more tolerated for, well, I don't know, 33% death rate. Yeah, you make a good point.
Remdesivir was still distributed in small amounts during the Ebola outbreaks of 2014 and 2018, but it was only for compassionate use, or in other words, as a last resort.
I wonder how far the other drugs made it up the clinic, right? In terms of phase 1, phase 2, phase 3, where are they now for Ebola? Just curious.
Beginning in 2014 and continuing to 2018, Gilead partnered with the University of North Carolina and Vanderbilt University in order to find out whether remdesivir would be effective against coronaviruses such as South Asian Respiratory Syndrome and Middle Eastern Respiratory
From a medicinal
Syndrome.
chemistry standpoint, this also sounds like almost sounds like a Hail Mary. When you're not getting FDA money, you're not getting private money, you can collaborate with universities and use some of their money, which is usually not a whole lot, to be honest. So, interesting sort of fable here.
Things looked very promising for remdesivir as it performed very well in both laboratory tests and in tests on live animals. However, the study never moved on to clinical trials because there were not enough SARS and MARS patients available in 2018 to perform a conclusive
Not enough
test.
SARS patients, not enough MERS patients. I suppose it's possible. It's almost like they're, just in case one of these explodes, we've got this in our back pocket. And wow, were they glad they did.
As remdesivir has been proven to act against other coronaviruses, it is currently undergoing extensive testing to ensure its safety and effectiveness for use against COVID-19. So far, it is doing pretty well. Dr. Anthony Fauci, director of the National Institute of Allergies and Infectious Diseases, claims that it reduces recovery time in its patients by around 31%.
Yeah, he's claiming that, but that's based on a study. I'd really like to see that study. He's talking about the 30% decrease in recovery time. What was it, like a couple hundred patients? This is what led to the emergency approval of the drug. So I wonder if you have the data on this.
And possibly reduces risk of death. These are the initial results of a test on 1,000 COVID patients from around the world.
All right, looks like you got the data.
In a test conducted by the New England Journal of Medicine, 68% of COVID patients... Now,
the New England Journal of Medicine does not conduct tests. They are just a publisher that publishes work of others. So I think that's slightly inaccurate.
Received compassionate use of remdesivir showed signs of improvement. A test by Gilead is also showing encouraging results. A fourth test conducted in China...
Okay, I have to say, as a medicinal chemist, to talk about all the data that goes into 1,000 patient studies and more, and just to say effective, I think we need a little bit more there. But, 5-minute talk, I get it.
Showed that remdesivir had no impact on severely ill patients. This may be due to not enough patients being tested, or the patients having also received other medicine
Honestly,
beforehand.
What I remember was that 30% reduction was for extremely ill patients, and that some of them did die anyhow, but it did show that it was working. It's one of the harshest tests you can do.
That altered the results. So in conclusion, remdesivir reduces recovery time for COVID-19, may reduce fatalities, it improves patients' condition in some cases, and
does not cure COVID-19, but I think like what Dr. Fauci himself said was that this demonstrates a proof of concept, and that this mechanism of action where it's an adenosine inhibitor actually works. And if you have a way to get into the cell, work your magic, destroy the virus from replicating, you're really onto something. And I think is really the key point. I get your comment that we need something now. We don't just need something that's fascinated. We need something that can be given out to patients worldwide. So, point well taken.
Does not cure COVID. Thank you to my sources: ACS Publications, Gilead Sciences, Wikipedia,
Okay,
the Prince,
let's see. Let me make sure I got all you got here.
the New England Journal of Medicine, University of California, San Francisco, Discover Magazine, Smithsonian Magazine, and the Journal of Biological Chemistry.
Okay, it sounds like you're done, so I'm just going to make a couple comments about things I like, things you could do next time, and your score. One of the things I liked the most was you went definitely on a college level. You immediately were focusing on real individual investigations from primary literature sources and what the results showed. So it was a deep, in-depth look. I saw things that I'd never seen before. For example, how remdesivir gets into the cell. It's in the form of that triphosphate. I would have liked to see perhaps a little bit more about mechanism of action, but I know you're just talking about the history there, so that was very good. Perhaps my favorite thing about this presentation, and then you've shown this throughout the year, is that I see a very critical mind at work, right? You are not necessarily going to say, ooh, wow, right? Like you point out that this does not cure things. And in fact, all it did was a 30% improvement in the recovery rate in one study. And you did point out that it failed to make it to the market for hepatitis. It failed to make it to the market for Ebola. It's only showing mixed results, however, proof of concept for COVID-19. So it's what in the medicinal chemists would sometimes refer to as a dog with fleas. It's got issues. It's not a magic bullet. And they've been saying that all along. But it does show you how, in the medicinal field, you don't want to give up on things. You keep pushing away. You accept that these limitations. You keep working on it. And this is a good example of something that, in many ways, I think this is a massive home run for Gilead, which is perhaps not for mankind, but the proof of concept thing is, I think, when we look back on this, that may be the thing that it becomes famous for. Of course, it's going to take a long time. So in terms of scoring, it's that 5 criteria: college level, inspiring, fascinating, not bullet pointed in 5 minutes. The only thing you lost 1 point for was the college level nature of the presentation. I mean, it absolutely was. There were just a couple of times where I wished you dug just a little bit deeper. Talking about the mechanism of action would be a little bit relevant there. And that list at the end where you were just like effective, effective, not effective. And I kept saying to myself, boy, that is quite a summary, one word for all of these studies. If I was an author, I'd be like, oh my God, you got to take a look a little bit deeper there. I did point out that I understand this is a 5-minute presentation. That's fine. So college level, 9 out of 10. Inspiring, absolutely 10 out of 10. Love the individual study investigation. Fascinating, well, this stuff is always fascinating to me. I think it would be to others as well. 10 for 10. Not bullet pointed. You know, it's funny how I don't even seem to notice if the topic is really good. I don't even remember whether it was or not. I give you full marks for that. And the timing was fine. So 49 out of 50. Thank you very much, Alex. Fascinating presentation.